Hi, my name's Skylar West, and I'm your dietitian.
Hi, I'm Fred. I'm here.
Hi, Fred. How are you feeling today?
I'm okay. I was pretty much told to come here by my doctor, my speech pathologist, so here I am.
So, what are we seeing you for today?
I recently had a stroke about a month ago, and while I was in there, I couldn't feel the right side of my face or my neck. So the speech pathologist came in, and they decided that I have decreased muscle strength and all that in my face and my neck, so I can't move this side or chew with this side, and also not swallow with my right side very well.
Okay. So, what do you know about strokes?
Not much. Since I was younger, I mean, probably when I was 25, 30-ish, I got diagnosed with high blood pressure, and I've just never really done much to change that. They told me to quit smoking, they told me to lose weight and exercise, but I didn't really feel like doing any of that. But now that I've had a stroke, it's probably something that I need to consider.
Mm-hmm. So, a stroke is when the blood vessels in your brain can't bring the blood through, and so there's a blockage or a rupture of the blood vessels of some sort. And in your case, it kind of sounds like a blockage from either your diet being high in fat or high in sodium and stuff like that, from your blood pressure being high.
I do eat out a lot.
Yeah.
Yeah, so that could be it.
Probably. So it says you're on a Dysphagia 2 diet?
That's what they told me to do, but I'm not really sure what that is. They
Yeah.
brought me food in the hospital, but I don't know what that entails.
Okay, so dysphagia is when you have difficulty swallowing. And so our biggest thing with dysphagia is to keep you from aspirating, which is sucking the liquids or the food down into your lungs and choking as well.
Okay, and what would cause that in mine?
The thinner liquids that you would drink, like water or milk, if you drink it too fast, you know how sometimes you can choke and it goes into your lungs, you feel like, and you're making you cough. That, it can give you pneumonia if that happens a lot. And so we're going to thicken any of your liquids that you're eating.
And this is because
drinking.
I can't feel or the muscles aren't working?
Yes, because your muscles aren't working. Your brain isn't sending those signals down to say, hey, muscles, let's work.
Okay.
And so since it was a stroke, it's neurological, and so it's just not sending those signals down.
Okay. And thickening the liquids is just because my
It will
muscles
help,
okay.
yeah, it'll help your other muscles to be able to get it down easier.
Okay.
And it won't just slide down your throat really quick.
And cause me to choke?
Yes.
Okay.
You are on a nectar thickness, and so you're going to want consistency of maple syrup, not as thick as honey or pudding. You won't have to go that far with your consistency, but just make maple syrup like nectar thickness if you think about nectars and stuff like that.
Okay.
And you can buy those thickeners at Walmart or through your healthcare provider, something like Walgreens.
Okay.
We'll have those agents that thicken your liquids. And then, do you know anything about what you need to be eating or the consistency?
No, I do not. I mean, it looked like dog food when they brought it to me at the hospital.
Okay, yeah. It's like a ground diet. Everything you want to eat is going to be soft or mushy and moist. You want to moisten all your food. You can either do that with a liquid, like a juice, or gravy, something like that.
Okay. So broth and water and stuff like that?
You can cook your food in broth. If you're going to make your vegetables, cook them where they're very mushy and in a broth.
Okay.
So things like carrots and mashed potatoes, cook them all down really nice and soft.
And you say ground, how do I grind up my meat? You said just to moisten it. So how do I do that?
Think of things like meatloaf.
Okay.
So meatloaf is very soft with all the ketchup in it and stuff like that. So you want kind of consistency like that. You can buy ground chicken and ground turkey from the store, or you could, if you wanted to go as far as ground it up yourself.
Okay.
It may be easier just to buy it already ground. But things like that. I have a handout for you that has food groups and stuff. So you can help remember. We want to stay away from breads and stuff. So if you want to eat a sandwich, you could eat a sloppy joe or a hamburger without the bun, so you're not choking on that bread unless you really watered it down. But at that point, it wouldn't be a bun anymore. Okay. If you really were craving that bread, just to get it really moist, maybe in a gravy,
okay,
or something like that, or a broth. And so you can eat things like eggs, scrambled and poached, or just soft eggs, soft cooked. we'll stay away from fried because we want to do more of a heart healthy. Do you know anything about heart healthy diets?
No, I do not.
Okay, so
Why
heart
do
healthy.
I need to follow a heart healthy?
For your blood pressure.
Okay.
Since you do have high blood pressure, we're going to do heart healthy to help you maybe lose some weight. So we're going to do low fat, low sodium. So we need to watch our sodium in our broths and our gravies. And we'll pick the leanest cuts of meat. And we'll do low fat dairy products. So low fat yogurt, low fat milk. What kind of milk do you drink?
Whole milk.
Okay. So maybe we can kick it down to maybe a 2 or a 1%.
Okay.
If you can't do skim,
Okay.
well, maybe
But I can do
2.
like a 2% or
Yes.
1%? Okay.
Yeah, but you'll want to make sure you thicken those. And things like yogurt, you wouldn't have to thicken those just because that's like a pudding consistency. But we'll pick the low fat ones.
What's lean meat? What do you mean by lean meat?
Lean, so your leaner ground beef, so higher in percentage if you look on the package. So like 80 or 90% lean.
Okay.
And then you could do chicken and turkey. Your white meats are leaner than your red meats.
Okay.
You can stick to like chicken and turkey and fish.
And like with chicken, can I cut it up, or does it have to all be ground? Can it be like finely chopped, or? Like...
We're gonna stick to like mushy because you're dysphagia too, so you're not quite puree, like just all
like
a liquid.
Food?
Yeah.
Okay.
So, but you're not quite a 3. 3 is chopped, so you want to keep it pretty mushy and wet. It sounds gross, but a better way to help you eat, if you set a plate like you're really eating and make it smell really good and taste really good, it'll help you with your appetite.
Okay.
Be more pleasing.
Okay. So with this heart healthy, you're saying I need to do low sodium and low fat.
Mm-hmm.
What about, do I need to eat fruits and vegetables? Can I eat fruits and vegetables with my diet, with the Dysphagia 2 diet?
We're gonna stick to as I said, the mushy. Cook your vegetables down pretty good. We're gonna stay away from the fibrous vegetables like broccoli, cabbage. Those are harder to break down and get soft.
Okay.
And for your fruits and vegetables, you want to stick with things that don't have the skin or without the seeds. So bananas, applesauce, any canned fruit that you like.
But I can't like peel an apple and eat it?
Huh.
Okay.
You could eat the applesauce.
Just not the actual apple?
Yes.
Okay.
We'll stay away from the apples for now.
Okay.
But do you like any canned fruit, like canned peaches or canned pears?
I like peaches and pears.
Yeah, you could have those.
Okay.
Or the fruit cocktails that come in there.
Okay.
Do you have any questions?
Besides like a diet, I kind of scared myself and my family members. I'm not married and I live alone, but as for like my brother and my sister, that kind of wanting to figure out ways to prevent another stroke from happening.
Mm-hmm.
So what would you say besides following a heart healthy diet? Is that my only option, or is there other things that I can do?
You said you smoked?
Yeah.
Okay, how much do you smoke?
I don't know, like a pack a day. Just depends. I'm not working anymore, so it's just whenever I'm at home and bored. But
Yeah.
I'd say like a pack a day.
If we could cut that down, that would definitely help. Also, another thing is when you're released to do exercise, maybe every time you get a craving to smoke a cigarette, go take a walk around the block. Is that something you could do?
I have a dog. It might like that.
Yeah.
So. But you said I have to be released before I
Yes.
can do it? Okay.
Your doctor will release you to do your exercise.
Okay. I guess I can do that.
Do you feel like this is something you can do?
Yeah. I mean, it'll be different having to alter and grind up all of my food, but I don't want to choke and definitely don't want to have another stroke. So I can try cutting back on cigarettes and walking my dog and then following this kind of diet.
Mm-hmm. And if you want, if you can't eat a full meal, sit down and eat that much if it's too cumbersome or you're just not feeling it. If we break it down into smaller meals, so you could do like a breakfast, a snack, lunch, a snack, dinner, and like a bedtime snack, and just cut down your portions, but just eat more frequently.
What will that do? Cutting down my portions and eating more frequently?
That will help keep you satiated. Maybe you wouldn't want to have the cigarette because you're not feeling, you're not feeling that boredom or stuff like that. And it will help you to lose weight because you're not going to be always snacking if you're always full.
Okay.
And it'll help keep variety in your diet so we won't get deficient in any area since you are having to cut some of the foods out that you eat.
I think I can do that.
Awesome.
At least try for now. small steps. But for sure, the mechanically altered diet, that's not really a choice. So.
Yeah. And even if you're feeling like you can eat more whole chopped up food, meet with your doctor before you do that. So you need to be released to maybe step up to a level 3. But if you keep working with your speech pathologist, you might get the feeling back in your muscles.
And they'll clear me. The speech pathologist will clear me before I can, and then go to the doctor. Okay.
Yeah, you want to make sure to be cleared before you change anything about your diet.
Okay. I can do that.
Awesome.
Well, it's nice to meet you.
You too.
Thanks.